If you're an aspiring nurse, you already know that nursing credentials and skills offer you a career path with staying power. In general, registered nurses are in demand, command a median annual wage of $65,470 as of May 2012, and job projections are strong. To really thrive, however, many RNs earn additional certifications, go for an advanced degree, and or decide to specialize in one particular area of nursing. This not only ups their earning potential, but it helps them qualify for positions at more prestigious hospitals or even open up their own practices. To help you decide which career directions is right for you, take a look at some of the highest paying specialties for RNs, what you can earn, and how to break in. Keep in mind that salaries do vary greatly based on location and employer, so the earnings listed below are just baseline to help with your research. Welcome to the Shakaama Live Show with your host, Shakaama. This is directed towards Black people, and here are the 15 highest paying nurse careers as of the end of 2015. Certified Registered Nurse Anesthetist, CRNA. This highly skilled profession involves prepping and administering anesthesia to patients in collaboration with surgeons, anesthesiologists, dentists, podiatrists, and other qualified healthcare professionals, according to the American Association of Nurse Anesthetists. Salary. Certified Registered Nurse Anesthetists earn an average of $133,000 per year as reported by PayScale, making it the top paying nurse specialty. Growth outlook. According to the BLS, the expected growth for CRNAs is 25% from 2012 to 2022. Requirements. Be prepared to hit the books in order to achieve a minimum of a master's degree from an accredited nurse anesthesia educational program, and upon completion, passing the National Certification Examination. General Nurse Practitioner. The advanced designation of General Nurse Practitioner means that you'll likely do much of the same work as you did as a RN license. However, you can choose to open an independent practice, and your advanced skills will offer lots of earning potential. Salary. General nurse practitioners can earn up to $97,990 as of May 2014 Occupational Employment Statistics. Growth outlook. Nurse practitioner jobs, which includes general, are expected to experience a 34% growth through 2022. And to that, the option to work independently and the outlook for this specialty is robust. Requirements. A Master of Science in Nursing, MSN, is the minimum degree requirement for becoming a nurse practitioner, followed by earning nurse practitioner license as specified by your state. Gerontological nurse practitioner. Older patients have a unique set of health issues requiring specialized healthcare. RNs who prefer working with the elderly patients should look no further than a gerontological nurse practitioner track. Salary. The BLS reports the median annual salary for this specialty to be $95,070 as of May 2013. Growth outlook. The aging population, longer lifespans, and more access to long-term care options means there will be greater need for nurses who specialize in caring for the aging. Requirements. To practice this specialty, RNs must become certified gerontological nurse practitioners, CGNP. Let me stick a dot in that right there. Hold on. Because if you are accepting stuff like Medicaid, Medicare, stuff like that, very often the government will pay you much less than what you're actually demanding as the fair pay for your services. So I would be very leery of this particular track. Pain management nurse. Pain management nurses help manage patient pain post-surgery or work with patients who have chronic pain issues. Their work within the healthcare team help determine the cause of the pain and the proper course of treatment, while also educating patients about pain management to avoid addiction or dependence on medication. Salary. The average yearly salary for this pain management nurse is $90,288 per year. Growth outlook. Because pain management nurses can work in a variety of healthcare settings, from hospitals to clinics, to rehabilitation centers, to nursing homes, the demand for this skill is strong. Requirements. While an advanced degree isn't necessary, sufficient experience as an RN is required to vie for nurse practitioner certification for pain management specialists. Psychiatric nurse practitioner. For nurses with an interest in mental health, working as a psychiatric nurse practitioner will give you the opportunity to work under a psychiatric physician and counsel patients regarding mental health disorders. Salary. A psychiatric nurse practitioner earns an average of $90,376 per year according to pay scale. Growth outlook. As the need for improved mental health care gains more and more national attention and the demand for adolescent and child psychiatric services increases, PNPs will be highly sought after. I caution you about dealing with adolescents and children. The FDA states on their opening website that they have not approved any medication whatsoever for anyone who is under the age of, I believe, like 21, 25, something like that. So be careful when you're doing that. You will probably open yourself up to lawsuit. Certified nurse midwife. For RNs who love obstetrics, labor and delivery, and prenatal care, becoming a certified nurse midwife is the perfect career path to nurture. CNMs mostly work with OBGYNs, offices, clinics, and hospital settings, but many open their own practices. Salary. Certified nurse midwives can expect to earn an average salary of $89,600 as per the BLS. Growth outlook. The job outlook for midwife is beyond good, with expectations that openings will grow 29% during the 2012 and 2022 decade. That is much faster than the average for all occupations and for RNs without a specializations, 29%. Requirement. To practice certified nurse midwifery, nurses can go through the American Midwifery Certification Board to earn the certified nurse midwife and certified midwife designations. I want to caution you, check in your state. Some states are trying to do away with this track. So while it says it's all hunky-dory, you need to check in your state. And I guess check with the American Midwife Certification Board. Family nurse practitioner. Family nurse practitioner, FNPs, is probably the type of nurse that is closest to being a doctor that there is. FNPs typically perform many of the same functions as an MD, working in a medical office, hospital, clinic, or nursing facility. Among their responsibilities included patients, consultations, assessments, prescribing medication and treatment, and more. Salary. Family nurse practitioners earn an average of $84,240 per year, according to pay scale. Growth outlook. As stated above, nurse practitioner jobs are expected to grow 34% from 2012 to 22, says the BLS. Those who focus on family practice will always be in demand since there are a variety of healthcare institutions for which they can work. Requirements. FNPs must earn the Family Nurse Practitioner Board Certified FNP BC, and most who go in this direction also earn a master's degree. informatics nurse. I see that there's some crossover with informatics. Nursing meet technology. According to the American Medical Informatics Association, an informatics nursing integrates nursing, its information and knowledge, with management of information and communication technologies to promote the public health. Here's what I would like to know. I have some other people who are going into informatics who have contacted me to ask me my advice. I'm thinking you could get an informatics, a specialization in informatics, and then go work in all sorts of industries. It's just simply the application. Salary. Indeed.com cites an average salary of $83,000 for informatic nurses. Growth outlooks. The AMIA estimates that up to 70,000 nursing informatic specialists, analysts may be needed in the next 5 years. Requirements. To get into nursing informatics, expect to earn a Master of Science in Nursing or Master in Information and Computer Science. Like I said, I don't think you have to be in nursing. I think you just can get a specialization in informatics and then go into nurse. Of course, you have to be an RN, but anyway. Clinical Nurse Specialist. Those who wish to work within a specialization unit or clinical clinic should consider the clinical nurse specialist path. In addition to diagnosis and treating various conditions, you'll be looked upon as an expert within your healthcare team. You might also specialize in a specific illness. Salary. As per pay scale, the median salary for clinical nurse specialist is $81,305. Growth outlook. Because clinical nurse specialists can offer specialized care at a lower cost than a physician, more and more hospitals and institutions will be seeking to add these professionals into their teams. That doesn't say anything, does it? Requirements. A clinical nurse specialist must earn a Master's of Science in Nursing with a specialization in clinical nursing. I think if you simply get that advanced degree, that you will be able to call the shots in a lot of specializations in whatever field that you want to go into. Nursing administrator. A nursing administrator deals with the backstage operations of nursing, from budget to staff management to HR functions. Salary. Nursing administrators earn an average of salary of $79,064 as per pay scale. Growth outlook. Employment of medical and health service management, of which nursing administrations are part, is projected to grow 23% from 2012 to 2022, according to the BLS. Requirements. Usually a master's degree in healthcare administration is required, as it state, and a state license. Nurse educator. At some point, you may wish to transition from patient care to nurse education. If working directly with other nurses to train them or facilitate continuing education sounds appealing, becoming a nurse educator could be a good fit. Salary. Nursing educators can earn an average yearly salary of $73,633, as reported by the AACN in March of 2014. Growth outlook. There is a shortage of nurse educators, and that is expected to continue, making this a smart choice if you wish to get off the hospital floor and go to the head of the class, literally. Requirements. Nurse educators must hold a master's degree at minimum, although many do earn a doctoral degree as well, so be aware of that. Neonatal nurse. I know this will probably appeal to a lot of women. If you have a real love of babies, caring for newborns is your main job as a neonatal nurse. This specialty commands a strong salary, especially for advanced practice nurses. Salary. The average hourly wage for neonatal nurses per pay scale is $29.60 an hour. Those who work in the neonatal intensive care unit have the potential to earn more, as do those with advanced certifications. Growth outlook. Both advance in technology and frequency of premature births have contributed to a strong job outlook for neonatal nurses, and that sounds horrible, doesn't it? My God. Requirements. While you can get a neonatal unit experience as a staff RN, earning either the neonatal nurse practitioner NNMPs, am I saying too many N's? NNPs or neonatal clinical nurse specialist CNS designation is how the real advancement takes place. Isn't it horrible? This is horrible. So you would be praying that for your specialty, if you want to really advance, get in the advanced positions, that you want horrible things to happen to babies. And me as a Pan-Africanist and a real humanist, not a NWO humanist, I pray that no baby should suffer anything. None of the no drug abuse. Women who do drugs while they're pregnant, stuff like that. Critical care nurse. Critical care nurses require a specialized set of skills since you're literally dealing with life and death matters. Often they work in ICUs of hospitals. Salary. The average salary for an ICU nurse was $68,028 as of January 2013, according to nursezone.com. Growth outlook. When you hear about nursing shortages, the biggest areas in need include adult critical care units, pediatric and neonatal ICUs, and emergency departments. That's why critical care nurses should have no problem finding work. That doesn't say anything. A shortage could literally mean people are just bad at staffing. That's what shortages could mean. So this doesn't say anything, and it doesn't give you an actual number or any sort of data as to the actual need. Requirements. While no specific credentials are needed to begin working in critical care, to advance, you should consider the CCRN certification exam. Health policy nurse. If you are passionate about health and public policies, becoming a health policy nurse will let you take on the task of advocacy, research, analysis, policy development, implementation, and evaluation as explained by discovernursing.com. Salary. While there is no specific salary survey for this track, the income potential is strong. Growth outlook. With so much attention to the Affordable Health Care Act, there is no better time to take this career route. Requirements. After earning your MSN, you'll have to complete a 10-week health policy residency program in government offices, advocacy organizations, or community groups. I would not recommend this way unless you're filthy rich and you have lobbyists in your family. Medical surgical nurse. Medical surgical nurses are on the front lines of the nursing profession because so much is required of them. Those who excel and decide to advance are considered to have entered a specialty area. Salary. Nurses who stay as medical surgical team members will earn a basic RN salary. However, advanced certification experience will increase earning potential. Growth outlook. Medical surgical nurse will always be in demand at hospitals and other healthcare settings. The sharper your skills, the more likely you are to be hired. Requirement. After working at least 2 years as an RN, you can take Certified Medical Surgical Registered Nurse, CMSRN, exam through the Academy of Medical Surgical Nurses, AMSN, Medical Surgical Nursing Certification Board, MSNCB. Now, why am I even doing this? Because they had on one of the debates, political debates that of course I do in my research all the time, talking about women's salary, and they were saying that the women are working at the hospital and they don't make as much as the men who work in the hospital. Well, then somebody said, no, that is untrue. Women make more in the hospital. If you're talking about a registered nurse with a specialty, in my top 10 majors that Black people should take when going to college, nursing was at the lower end. Now, what did I say was the top salary here. I said the CRNA was the top salary, clocking in at $133,000. But I said in the top 10, they all start at around $100,000 anyway. Start. And then mid-range, they're up in the 150, 180, 200, 300, right? So why would you sit in class, study, just so you want to go, even if you were to go into a specialty, which takes even more time, certification, learning, and you have to go through all of your training and stuff, extended training, you're going to come out making $80,000. And I don't want you to sit in your chair and say, but $80,000 is a whole lot of money. Okay, let's say you start today. So you're going to get the $80,000 in 10 years? What is $80,000 in 10 years going to look like? There was a time when $30,000 seemed like a whole bunch of money during my lifetime. $30,000 looked like a whole bunch of money. And now it's nothing. You cannot live the middle class lifestyle with $30,000. You have to scrimp and do without. You cannot go on vacation yearly. $30,000. What kind of job pays $30,000? So now I'm saying 10 years from now, what is $80,000 going to look like? I'm saying if you're going to shoot high. Shoot for the top. You're sitting in the same damn school. Why would you do nursing versus other stuff? I know it's much harder, but it's in much more demand. Even the people sitting in the class, in the engineering classes, 50% of them are going to get their degree and leave the country and go back to their own country. So not only is it in demand, but we are bleeding out degrees. We have the world sucking the degrees away. Now, you and me, we can't change that these people come over here, get the degree, and then leave. We can't change that. You and me, we can't change it. We're not politicians to even allow such a ridiculous thing to begin with. But what we can do, what I can advise you to do, is to get one of those damn engineering degrees. I think on a level of difficulty, nursing, going to school for nursing, is just as difficult as engineering. Oh, trust me, this is why I'm able to pronounce some of these words. I've taken a look at it. I know you're saying, oh, he's fumbling over all of these words, but I have taken a look at it. So it seems plenty difficult to me. I don't buy that you say that engineering is so much more difficult than this. Thank you for watching the Shakaama Live Show.